Hello, my name is Leah Crown. I'm the Director of Health and Human Services for the City of Meriden. It is time for our weekly social media question and answer video. This week we only received 3 questions, and I thank you all for your questions. As you are aware, COVID-19 is still a rapidly changing situation, and the answers to your questions today are based on the Center for Disease Control and Prevention guidance, the latest governor's executive orders, as well as general disease knowledge as of today, May 19th, 2020. So our first question is, if I have a blood test request, will the lab test it for COVID? There are actually many tests being used right now to diagnose COVID-19 that the U.S. Food and Drug Administration, more commonly called the FDA, has authorized for use during this current emergency. All of these viral tests identify the virus in samples from the respiratory system, such as from a nasal and nasal pharyngeal swab. There are also some tests out there that use saliva samples. There is no current blood test to diagnose someone with current COVID-19 infection. There is a test out there called an antibody test that does use blood. However, that is to test for prior infection, not for current infection. The second question, if you test positive for COVID and you pass the quarantine phase, do you have to get retested to verify if you are okay? How do we know that we are doing fine? So the CDC actually has 2 sets of strategies to help someone stop self-isolation if they are caring for themselves at home. The most common one, and this is the one that we use here at the health department, is using a symptom-based strategy to determine if someone is still contagious. This person must meet the following things before they can stop self-isolation. So the first is if they have had no fever for 72 hours without fever-reducing medicine. The second is if they have had an improvement in respiratory symptoms, such as their cough or shortness of breath has gotten better. And the third is at least 10 days have passed since their symptoms first appeared. The other method that mostly primary care doctors use and those who are being discharged from a hospital use is called a test-based strategy. So if your doctor is going to order tests to determine if you are still contagious, a person can stop self-isolating once these 3 things happen. So again, you've had no fever for at least 72 hours without the use of fever-reducing medicine. The second is if your other symptoms have improved, again, such as that cough or shortness of breath. And the third one is that you have to have 2 negative COVID-19 tests in a row, and they have to be at least 24 hours apart. So the test-based strategy is contingent upon the availability of ample testing supplies and laboratory capacity, as well as convenient access to testing. Our third question was, will someone who has cystic fibrosis, diabetes, and asthma be able to get the shots they need to start school when doctors don't know what is going on? So I did a little bit of research on this, and unfortunately I'm not able to answer this question directly. It's a very patient-specific question, so I'm going to have to ask whoever asked this question by social media to get in touch with their primary care doctor to get the answer to their question. Many doctors' offices are starting to reopen under the Reopen Connecticut plan and may be able to serve you. So we've only received the 3 questions. Again, thank you all. If anybody needs to reach out before the next video, please contact us at 203-630-4226, and we'd be more than happy to answer your questions. Thank you.